Okay, so we are going to continue our topic about diuretics. So dito na tayo sa classification. So we are going to discuss the different classifications of your diuretics. Of course, diuretics are classified as high ceiling, or yung tinatawag nilang high ceiling are also called your loop diuretics. Also, your thiazides diuretics, meron din yung tinatawag nilang thiazide-like diuretics. Meron din yung carbonic anhydrase inhibitors. Meron din yung potassium-sparing diuretics. That is osmotic, guys, hindi siya osmotic. Meron ding osmotic diuretics, of course. And then meron din tayong low ceiling diuretics. So, let's proceed now. Okay. So, diuretics classification. So, we have here your high efficacy diuretics or your, what do we call that? Your high ceiling. High efficacy diuretics or your high ceiling diuretics. They are of inhibitors. Their mechanism of action are inhibitors of sodium, potassium, and 2-chloride co-transport. So, number one, classification of your high efficacy diuretics are your furosemide, sulfamoyl derivatives. Derivatives yan, guys, ha? Your furosemide, of course, bumetanide, then your toracimide. Meron din tayo isa. Another one is your phenooxyacetic acid derivative, which is your etacrinic acid. So, meron din tayong kung may high efficacy, meron din tayong medium efficacy. So, what is that? So, syempre, ang medium efficacy diuretics natin are the mechanism of action pala kasi isa, is inhibitors of sodium and chloride symport. So, the classifications, of course, letter A, your benzothiazidines or your thiazides diuretics. And then, meron din tayong mga thiazide-like, which examples of your thiazides are your hydrochlorothiazide, benzthiazide, hydroflumethiazide, cyopamide. Yung thiazide-likes naman, meron tayong chlorthalidone, metolazone, cipamide, tsaka indapamide. Guys, tandaan nyo yung classifications, ha? Diyan lang umiikot yung boards sa classification. Okay? So, next, weak or adjunctive diuretics. So, kapag sinabi natin weak or adjunctive diuretics, they are just an addition. For example, they are just in addition with your weak, with your medium or your what? Or your high efficacy diuretics. Adjunct lang sila. So, tumutulong lang sila. So, weak or adjunctive diuretics. So, meron tayong acetazolamide. And then, carbonic anhydrase inhibitors yun. Potassium-sparing diuretics naman, meron tayong aldosterone antagonist. Yun si spironolactone. May iyon, ha? Tsaka si eplerenone. Napunta yung E doon sa eplerenone. Okay? Then, inhibitors of renal epithelial sodium channels, meron tayong trimterin tsaka si amiloride. Okay. So, osmotic diuretics naman. So, mannitol. So, ang mannitol used for your diuresis for saan? Doon sa kapag may cranial pressure. Okay? Xanthines naman, that is your theophylline. Theophylline, guys, ha? Theophylline. Okay. So, kung mayroon tayong diuretics naman, mayroon tayong tinatawag na anti-diuretics. Of course, kapag diuretics, pinapaihi. Kapag antidiuretics, hindi niya pinapaihi. So anong sakit mo kapag gumagamit ka ng antidiuretic? Meron kang severe diuresis. Lagi kang naiihi. Okay? So meron tayong mga different drugs for your antidiuretics. So number 1 is your antidiuretic hormone or your ADH and its analogs. So what is that? Your vasopressin. Guys, tandaan nyo, vasopressin is an hormone. It is used as an antidiuretic hormone. Guys, tandaan, huwag kayong malilito. Kapag sinabing diuretic, pampaihi. Kapag sinabing antidiuretic, hindi ka pinapaihi. So, we have here your vasopressin, desmopressin. Analog na lang ng vasopressin si desmopressin. But, desmopressin has more promising effect than your vasopressin. And then, meron tayong lipressin, terlipressin. Diuretics naman, meron tayong thiazides, amiloride. So, pwede siya. Yung mga what do we call that? Yung mga yung mga diuretic agents natin, pwede rin silang gamitin as your antidiuretic. Examples are your thiazides and amiloride. So, miscellaneous naman, for your antidiuresis, your chlorpropamide, and then your carbamazepine. So, mechanism of diuretics. So, nandun naman na kanina. So, site of action, kapag sinabi nila na high ceiling or high efficacy, they inhibits the sodium, potassium, and 2-chloride transport. Yan. So, we have here the loop diuretics, or the site of action of your loop diuretics are on the loop of Henle. Doon tayo sa channel inhibited, so sodium, potassium, and 2-chloride. So, percent excreted up to 25%. Okay, kapag naman sinabi nating thiazides, so thiazides are medium efficacy. So, they inhibits the sodium and chloride import. So, up to 3 to 5% excreted. Kapag doon naman sa cortical collecting tubule, meron tayong mga potassium sparing, si spironolactone, amiloride, and triamterene. Ang kinakwan lang nila, channel inhibited, is your sodium channel up to 1 to 2%. Okay, yan. So guys, dito gumagawa si thiazide diuretic. Dito naman si potassium sparing diuretic. Then meron din tayo dito sa ascending loop and then descending loop of Henle, si loop diuretic. So distal tubule, and then meron tayong collecting duct, si potassium sparing. Okay? Dito si inhibit active exchange of chlorine and sodium in the cortical diluting segment of the ascending loop of Henle, si thiazide. Then si potassium naman, distal convoluted tubule or your collecting tubule. Then si loop diuretic naman, dito thick segment of the ascending loop of Henle. Guys, tandaan ha, basta si potassium sparing doon sa collecting duct, si thiazide diuretic doon sa ascending loop of Henle, and then si potassium sparing doon sa distal convoluted tubule. Okay? Then, of course, we have here mechanism of action of loop diuretics. So, kapag sinabing loop diuretics, sodium and chloride are not reabsorbed, resulting in increased excretion of these ions. Okay. Sodium and chloride are not reabsorbed, resulting in increased excretion of these ions. So, what would you expect? For example, you are going to see this statement and you are going to conclude this side effect already. Oh, kung mawawala ang sodium, hindi marireabsorb, anong mangyayari? So, you are going to have your hyponatremia already because it is excreted. hindi naman nare-reabsorb. So, ano mangyayari? Magkakaroon ka ng hyponatremia. And the chloride are not reabsorbed also. So, magkakaroon ka ng high metabolic what? Metabolic chloride mixed acid. Pero nawawala. Magkakaroon ka ngayon ng metabolic metabolic alkalosis. Okay? Did you get that? So, ayan. This is the blood. Papasok yung potassium to epithelial cell. Dito yung lumen. Okay? So, it inhibits the chlorine and sodium. So, hindi na sila makakabalik kasi na-prevent na to, na-inhibit. So, ano mangyayari kay chloride tsaka sodium? May excrete sila. Okay? Guys, tandaan niyo ha, sodium and, di ba, dito yung binding ng chlorine. Pero, ininhibit ngayon ni loop diuretic. So, anong i-expect mo? Ma-absorb ba sila? Hindi. Even your sodium na dapat papasok doon sa may chlorine binding, papasok din doon, hindi na din pakakapasok yung salt. Kaya mailalabas. Okay? Only your potassium will be reabsorbed. Did you get that? Okay. So, loop diuretics. So, site of action enter via filtration and secretion by the OATs or your, what do we call that? Your act on thick ascending loop of Henle. Okay. Then mechanism is your inhibition of sodium potassium 2 chloride importer, positive luminal potential, magnesium, calcium, and then reabsorption, mababa. So, positive luminal potential, bababa ang magnesium. Okay? So, ang calcium reabsorption, mababa din. So, magkakaroon ka ng hypochloremia due to sodium potassium chloride block, large doses abolish osmotic gradient. Renal vascular resistance, bababa, RBF via, tataas yung RBF, and then via effect on prostaglandins, of course. Then your kidney is not able to produce dilute urine. After initial strong diuresis, diuretic, breaking urine, increased excretion of all ions, sodium, chloride, potassium, hydrogen, magnesium, calcium, as well as bicarbonate in case of furosemide. So, plasma, hypochloremic alkalosis, and hypokalemia. Sabi ko kanina, metabolic alkalosis. Mechanisms are similar to thiazide diuretics and will be considered shortly. Okay? Okay. And then indications and side effects of your loop. Of course, indication and side effects, large volume diuresis, isotonic urine as compared to plasma. So indications, meron kang edema. Lalo na kung meron kang congestive heart failure, acute pulmonary edema, cirrhosis, nephrotic syndrome, hypertension, hypercalcemia, forced diuresis. Side effects naman, excess volume depletion, circulatory collapse, azotemia, hyperuricemia, hypokalemia, which may cause cardiac arrhythmia, hypocalcemia, hypomagnesia, ototoxicity. So, loop diuretics can be used for edema, hypertension, hypercalcemia, and then forced diuresis. Okay, but the side effects are excess volume depletion, circulatory collapse, azotemia, and hyperuricemia. Also, hypokalemia, cardiac arrhythmias, hypocalcemia, of course, kasi ang isang indication niya is hypercalcemia. So, maaari na biglang bababa ang calcium content mo. Even your hypomagnesia kasi lalabas yung mga ions. And then, of course, guys, tandaan nyo, ototoxicity. Okay. Thiazides naman, mechanism of action. Act in the distal tubule, inhibit reabsorption of sodium and potassium, stimulate the reabsorption of calcium, loss of water as urine. So mechanism of thiazide diuretics. So thiazide diuretics mechanism of action, sodium and chloride are not reabsorbed, resulting in increased excretion of these ions. So sodium and chloride ulit are not reabsorbed, resulting to the increased excretion of these ions. So they are going to be excreted again, katulad nung kanina. So sabi nga kanina doon dito, sabi nga niya, so mechanisms are similar to thiazide diuretics and will be considered shortly. Okay? So, yan. Parehas din lang halos. Thiazide diuretics, your pinaka pinakasikat na thiazide diuretics are your what? Your hydrochlorothiazide. Okay. So what are the therapeutic uses of your hydrochlorothiazide? It is absorbed orally, bound to plasma proteins, secreted by the OAT and PT. Hypertension reduces blood pressure by reducing volume and producing mild vasodilation. Okay. So congestive heart failure. So meron kang hypercalciuria to help prevent renal stones. Nephrogenic diabetes insipidus, renal insensitivity to antidiuretic hormone. Thiazides, kapag thiazide, guys, nephrogenic diabetes insipidus, tandaan niyo ha, ang indication, one of the indication of your hydrochlorothiazide is for hypercalciuria to help prevent renal stones. And then, nephrogenic diabetes insipidus, guys, ito, lumabas boards. Nephrogenic diabetes insipidus, what is the best diuretic for that? Ang sagot doon is your hydrochlorothiazide because thiazide will lower the plasma volume, lower the glomerular filtration rate, and then reabsorption of sodium in the PT, tataas. So, less sodium and water each collecting duct, so overall fluid conservation is obtained. Ganyan. Okay. So, ayan. Ayan. So guys, yung PT is your proximal tubule. Your PT is proximal tubule. Okay. And then, your OAT ano na yung OAT? Hindi ko na ma-remember yung OAT. Okay, tuloy tayo. Mamaya, mariremember ko din yung OAT na yan. Adverse effects. So, meron tayong, of course, electrolyte imbalance, hypokalemic metabolic alkalosis, hyponatremia, kasi sabi nga kanina, same as doon sa loop diuretic, yung mechanism of action halos. Okay, so hyponatremia, hypercalcemia, hyperuricemia, hypochloremia, cardiac arrhythmias, hypokalemia, increased risk of torsa de pointes caused by guanidine. Guys, tandaan nyo yung hypercalcemia. Okay? Hypercalcemia. Okay. Hypercalcemia, bakit siya adverse effect? Okay. Bakit siya adverse effect? And then, hyperuricemia, hyperchloremia, and then cardiac arrhythmias. Guys, tandaan yung hypercalcemia, yun lang yung pagkakaiba nila doon sa loop diuretic. Di ba sa loop diuretic is hypocalcemia. Ayan. But here in your thiazide, it is used as the side effect is your hypercalcemia. Bakit? Kasi because of its hypercalciuria. Okay, one of the indications is hypercalciuria. Okay, so hypokalemia increases risk of torsades caused by guanidine. Hypotension due to volume depletion, hyperglycemia in patients with diabetes or abnormal glucose tolerance test, mechanism poorly understood. Hyperlipidemia, an increase in the levels of low density lipid, total cholesterol, and total triglycerides, and also hypersensitivity. Guys, meron din tayo isa pa sa classifications is your potassium-sparing diuretics. Ang pinaka sikat is your of course spironolactone. Okay? Your spironolactone. Okay. Okay, spironolactone. So what is the mechanism of action? Competitively binds the aldosterone receptor, preventing the hormone from binding to its receptor. Aldosterone's normal steroid nuclear DNA transcription is halted. Guys, tandaan nyo yung RAAS, your renin, angiotensin, aldosterone system. That's your RAAS, no? So, dito po papasok si spironolactone. Okay, so, next is your osmotic diuretics. So, pinakasikat dito is your mannitol. Raises osmotic pressure on the plasma, thus draws water out of the body. Tissues produces osmotic diuresis, does not affect sodium excretion. So, osmotic diuretics therapeutic uses are to treat the patients in the early oliguric phase of ARF, and then to promote the excretion of toxic substances, production of intracranial pressure, and then treatment of cerebral edema. So guys, kapag natubigan, sinasabi nila, tubigan yung ulo, yan, so sinasabi nila kapag sa mga disgrasya, ito yung ginagamit, mannitol. Pharmacological actions of diuretics, of course, kapag high ceiling or loop diuretics may cause a substantial decrease up to 20% of the filtered load of sodium chloride and water. Loop diuretics such as furosemide inhibits the body's ability to reabsorb sodium at the ascending loop of Henle in the nephron. So, thiazides naman, such as your hydrochlorothiazide, act on the distal convoluted tubule and inhibits the sodium chloride importer, leading to retention of water in the urine. So, frequent urination is due to the increased loss of water. So, the long-term antihypertensive action is based on the thiazides, which decrease preload and blood pressure. Kapag sinabi naman natin carbonic anhydrase, so carbonic anhydrase inhibitors are to inhibit the enzyme carbonic anhydrase, which is found in proximal convoluted tubule. This results in several effects, including bicarbonate retention in the urine, leading you also to metabolic acidosis. Tandaan niyo ha, kapag ang bicarbonate ang na-retention sa urine or na-reabsorb, that causes your metabolic acidosis. Potassium retention in urine, decreased sodium absorption, acetazolamide, and then metazolamine. Potassium sparing naman, ito yung mga aldosterone antagonist, or your very example is your very sikat na example is your spironolactone. These are diuretics which do not promote the secretion of potassium into the urine, leading you also do not promote, so the potassium will be reabsorbed. So ano mangyayari? You are going to have your hyperkalemia. So ito lang yung diuretic na nagkukos ng hyperkalemia, because the reabsorption of potassium will be the reabsorption the excretion rather, the excretion of your potassium will be inhibited. So hindi mapropromote na lumabas yung potassium, kaya nare-reabsorb. So potassium is retained and not lost as much as with other diuretics. The term potassium sparing refers to an effect rather than a mechanism or location. So which is a competitive antagonist of aldosterone? So aldosterone adds sodium channels in the cells of collecting duct and distal tubule of the nephron. And then spironolactone prevents aldosterone from entering the cells and preventing sodium reabsorption. So we have examples, eplerenone, then potassium canrenonate. Epithelial sodium channel blockers, amiloride, and then triamterene. Triamterene yan guys ha. So osmotic diuretics, the compounds as mannitol are filtered in the glomerulus but cannot be reabsorbed. Their presence lead to an increase in the osmolarity of the filtrate. To maintain osmotic balance, water is retained in the urine. Glucose like mannitol behave as an osmotic diuretic. So guys, tandaan nyo, osmotic diuretic na si mannitol ay isa siyang sugar. In the form, hexa sugar siya, hexose. So glucose. Glucosuria causes a loss of hypotonic water and sodium, leading to a hypertonic state with signs of volume depletion, such as hypotension and then tachycardia. So, guys, sorry for the spelling ha, pakicheck na lang. Okay, low ceiling diuretics. The low ceiling diuretics are used to indicate an diuretic has a rapid flattening dose effect curve. It refers to a pharmacological profile, not a chemical structure. So medicinal uses of your diuretics, they are used for your heart failures, liver cirrhosis, hypertension, certain kidney diseases like your what do we call that? Doon sa thiazide diuretic, your hypercalciuria. Okay. Uses and side effects. Ayan. So you are just going to read na that one. Okay. So loop diuretics, meron tayo dyan. And then, guys, tandaan nyo din ha, si loop diuretic, ang pinakasikat na side effect niyan is ototoxicity. Pakitandaan yan ha. Laging lumalabas. Okay. So, ayan. So, the references. Okay, thank you very much and thank you for listening. If you have questions, feel free to ask me on our group chat doon sa Messenger. Okay, thank you and God bless to all of you.